We're still in containment phase, but we have to start preparing.
The message from health officials is a mix of reassurance and caution.
We're also starting to prepare for a possible pandemic. So we can't do this with our eyes closed and not recognize what might happen weeks and months from now.
Travelers who have visited Hubei province in China still get extra screening. Others in airports are asked to speak up if they have any symptoms. But health officials say simply shuttering Canada to anyone isn't a solution.
It's not about closing the borders. It's certainly from a public health perspective, closing the borders has never proven to be effective in terms of stopping the spread or the introduction of disease into any country.
Officials say the healthcare system is preparing too, including lessons learned from past outbreaks.
Right now, we're doing 30 or 40 tests a day. Our lab can do up to 1,000. But we don't want to rest on that. What happens if we have to go to 2,000 or 3,000? How are we going to prepare for that? So you got to do that preparation now.
Even the armed forces, which has helped with repatriation flights and quarantines, says it's ready to do more.
We are currently refreshing contingency plans for a larger domestic response.
I think it's always wise to be prepared from a community and a country level.
The health minister said today Canadians can play a role as well by washing their hands, staying home if they're ill, and being ready the same way they would for a major snowstorm or power disruption.
There's no magic to this. It's really about, first of all, making sure that you do have enough supplies. If someone in your family becomes ill, if you yourself become ill, that you have what you need to survive, for a week or so without going out.
The goal is to reassure. Officials insist Canadians' risk of getting COVID-19 is low and that they are ready to respond if that changes. Catherine Cullen, CBC News, Ottawa.